All right, it's the top of the hour. My name is Tom Betlock. Welcome to Crisis Jam, episode 71. We're 107 days out from July 1st, and today we're going to touch on the promotion and partner toolkit. So we've got Kate Galatas, who's on loan to SAMHSA from the CDC, and we're excited to have her and find out what's going on in terms of the different materials that are being pulled together as we look ahead to 988 rollout. My name is Tom Betlock. I'm the former Medicaid director from the state of Arizona, and I serve as a partner with Spire Healthcare Strategies. We continue to grow in terms of the number of organizations that participate in Crisis Jam, up to 61. We have all 50 states, behavioral health offices that are participating. We still have not topped our 404 participants that we had on February 2nd. Newsletter, email list, you look there, 2,430 individuals, and we've got those resources available at the end of the presentation in terms of the different links. Next slide. And here it is, the different learning opportunities and resources. You have videos from all of the previous sessions of Crisis Jam. You've got a lot of different materials, crisis talk, and all the different resources that are out there as we look forward to the rollout of 988. Next slide. So in terms of the quote for this week, no one interviewed for this story supports boarding. Instead, it's widely viewed as a grim reality. This story was brought to us by Hannah Furfaro from the Seattle Times, the Mental Health Project. It was reported in February of 2022, where they highlighted as part of that article, an individual, a child who was in a windowless emergency room for 33 days without sunlight. And so this article, again, continues to highlight the grim reality of emergency rooms and boarding. And certainly we're looking for alternatives to that as part of our Crisis Jam and our discussions, and looking at better systems, better continuums of care to support those in crisis. Also this week, the New York Times came out with an article that highlighted the rollout of 988, and it looked at Lifeline and the responses for the current volume of Lifeline calls. It highlighted the fact that obviously with the rollout of a new 988 number, there's the expectation of significantly increased demand, but also highlighting the need for states and call centers to be able to expand their capacity to meet that demand. There was interesting data that was shared that highlighted the response for states in terms of calls answered and the percent of calls answered. So I would tell everybody to take a look at that. And certainly it's anticipation of the July 1st rollout of 988. And the article is there in the link in the chat for those that are following along with that. To highlight some positive news, if you need life advice, press 2. If you need a talk from kindergartners, press 3. So we've got a pep talk hotline that is out there. It's getting overwhelmed in terms of the number of calls it is receiving, but it's free words of kindness. And so you can always look for a kindergartner in terms of free words of kindness. I know my daughter who works in the daycare industry, I ask her every day to come home and share a story, because we know our little ones, they're always full of kindness and can brighten a day. So today, we're going to talk about the 988 communications briefing. We've got Kate Galatas, who's with us. And so Kate, I'm going to turn it over to you.
I wanted just to really start by saying, I participated in my first Crisis Jam in late August when I joined SAMHSA on detail, and I've learned so much from this community since then. Thanks for having me today. And I'm really honored actually to be the one that gets to kind of represent a body of work that so many people have contributed to. So talented communicators from across SAMHSA, CDC, Vibrant, the Action Alliance, and more have really come together to help us get where we are today. I'm delighted to be able to be the one who gets to present it. But I don't want them to go unnoted because it was a lot of work. So we can go to the next slide. Here's what we'll touch on today. But if you leave here actually remembering one thing, let it be this. The 988, our 988 communication strategy and materials and everything that you'll see today, it's really just a testament to the power of crowdsourcing. So we've done extensive partner engagement and vetting, and it's just really been central to what got us here today, and it will be central to how we grow moving forward. Next slide. So I've worked at CDC for over 20 years, so I'm more than a little familiar with startling statistics. But I wanted to start today with these because they're nothing short of alarming, and it's nothing new to all of you. I truly know that this is your life's work, but I think the pandemic has really shifted our country's collective experience with mental health and has really added urgency to our already urgent need to respond. Next slide. Part of how we respond to this urgent need is through sharing messages of hope. And the Lifeline and its network of crisis centers across the country meet this urgent need, meet these challenges every single day. Their life-saving work is truly hope in action. Next slide. So we're all working towards the transition to 988 on July 16th of 2022. And there is much work to be done to really make the most of this transformative moment. Today, I will really focus the rest of the presentation on the communication work in support of getting to and through July 16th, but I don't want to do that without acknowledging that I know there are so many of you and so many people across the country who are doing just a heavy lift of work in advance of July 16th and looking at the future of where we could be. And I just want to make sure I acknowledge that there's more going on than just the communication piece. Next slide. So from the outset, SAMHSA's primary communication strategy has really been to work with and through partners, through just the network of partners, to arrive at several things, frankly. First and foremost, it's arriving at a look and feel that begins to brand 988. Hopefully what you're seeing in this presentation alone, you'll recognize that we're aiming for hopeful, crisp, warm, inviting imagery and colors and everything that goes into a brand. We also have used this partner engagement strategy to arrive at published materials that really support the communication planning efforts of partners across the country. So we'll drill down on those in a few minutes, but we're publishing materials that we hope help our partners in their planning efforts. And then we really have, oh, sorry, not yet. So sorry. And we're also really committed to continuing in this coordinated approach so that we really drive a common 988 narrative together for the country. This is really important in advance and at the point of transition and beyond. So, and then know that we are committed to continuing to produce and to really build out more. We know that what we're about to show you today is the tip of the proverbial iceberg of what folks really need. We're aware of that, and we're committed to building more. Okay, now I'm ready for the next slide. So SAMHSA, along with Vibrant and the Action Alliance, have been co-leads of the National 988 Messaging Task Force. And this task force has really been a rich, a diverse group of public and private partners who have worked together over the past 6 to 8 months to arrive at and develop what we're calling the 988 messaging framework. So the best way I think to think of the framework is as kind of a guide, a guidance document for the 988 implementation partners. But it's really sharing important tips for how to approach 988 communications. And it will build on the Action Alliance's existing framework for successful messaging, and it will be available on their website as early as next week. And I hope you all are able to go check it out. So the next page, next slide. So as important as the framework is as the kind of how-to or the approach to 988 communications, we at SAMHSA are very aware that partners are awaiting concrete guidance on not just the how, but the what, the messaging, the content, the materials. And so welcome to our 988 webpage. We launched it yesterday. Can you guess what the driving event was? Yes, it's today. We launched yesterday, and it's intended to be really a one-stop shop for 988 resources for our partners. So I want to take a second to, I know you can't see the screenshot very well, but hopefully you'll go visit the site and bookmark it. And when you do, you'll notice a couple of things. First and foremost, I want to talk about the shaded blue box you see on the web screenshot there. And that's on every page, subpage of our 988 website. And that's there very specifically because the site is engineered and intended for you guys, our partners who are doing all the planning and readiness around communication and other aspects of 988. But we also realize that folks who might need support may inadvertently end up there. So we want to make sure that we are redirecting them to the lifeline itself if in fact they need support. I will also say on that note of redirecting, I will also say part of our partnership effort includes regular meetings that we're now having with all the big tech companies and social and digital companies. So the Googles, Facebook, Meta, Instagram. We, SAMHSA, along with Vibrant, are meeting with them regularly to make sure in advance of the transition to 988, there are no interruptions in terms of how quickly people can access and get where they need to be. So just wanted folks to know that we're doing that as well. And as you can see, each of these icons on here represent a different area where you can click in and get some more resources, everything from getting quickly to data that's available from both CDC and SAMHSA. There's an interactive history of the lifeline, so a little timeline that's interactive. And of course, there is the partner toolkit itself. So if we move on, if we can go to the next slide. So I wanted to spend a little time on the partner toolkit itself. So when you click into it, you're going to see first the key messages. So what's currently there and available are these key messages that I want to make sure folks understand the right context for those. So these are, again, high level and broad messages about 988 that we think all of you might use. You might build from these. You're going to have, I'm sure, specific audience needs that you'll need to kind of build from this foundation and work towards. But really, these are ones that we hope everyone uses as that foundation so that, again, we can drive that common 988 narrative. So those are there. In addition, we've heard from a lot of our partners about frequently asked questions. So you'll see now that there is a really robust set of FAQs that are out there about 988. And so we encourage you guys to use those. You'll see that there is an overview, a 988 overview fact sheet that we have available to download both in English and Spanish. So, and that is what's there in the partner toolkit to date. Again, in the weeks and months to come, we will be continually adding both to the website itself, but specifically also to the partner toolkit. Again, we know that you guys are engaged in communication planning efforts, and these are intended to help you drill down and do more of that planning that we all need to be doing in advance of the July 16th transition. So if we can. So again, with crowdsourcing in mind as our way of vetting, we've really heard pretty clearly that there are some materials that partners are already letting us know that they want and need. So you'll see that list here. And of course, we can't produce everything at once. And we're probably missing some things that you guys might think are critical. So we are going to now embark on more of our crowdsourcing efforts and do one of the fun Crisis Jam polls. So I think this is where I'm going to get some help. Yep, here we go. So you can only choose 3, but we want you to choose your top 3 of the list here, items that you think you would really need and use. So go ahead. You can't pick everything. All right. I think we'll give a few more seconds and we'll get some results. Great. All right. Infographics. All right. This is great. Actually, this is really, really great. And I know now in the chat, I think we can do the other portion of this poll, which is what's missing from our list. So the great folks at Crisis Jam have promised me they're going to capture the chat thread and send it to us. But if there are key things that you really would use that are missing from our current list, we want to know what those are. Okay, so that was fun. Thank you guys for participating. We will really, it really is, this is exactly what we need to hear and get intel on that helps us align our resources for what folks not just perceive they need, but what they would actually use. And that's really central. So thank you guys. And now my next slide. So here's where the proverbial rubber meets the road. What can each of you do? In short, it's really helping us drive a common narrative. So use and share the key messages, the FAQs. When the message framework comes out, please make use of it. Keep sharing with us your input and your feedback so that in the run up to July 16th, we're as coordinated and aligned on 988 communications as we can be. And what else can you do? Well, kind of most importantly, you can keep doing your life-saving work. You can keep being hope and action to so many in our country who really need our support. And we can move together towards this transformative moment and do the most good. Thank you.
Kate, that was wonderful. Thanks so much. Loved your message of hope. You blew up the chat by asking for additional input. I know you were busy presenting, but you probably missed the fact that you were getting so much feedback on other options, whether it was magnets for a refrigerator or other things like that. There was a lot of feedback. So
Great.
capturing that and taking that as part of your crowdsourcing effort, certainly there. You must be thrilled to have the website up. I know launching those is always a big lift. So congratulations on that. How frequently do you envision updating the materials? Is that something we should come back to daily, weekly? What do you think in terms of the
I
frequency
think
of
our
updates?
we're aiming for our next big update to be the around mid-April. So we're giving ourselves the next month to really take the content that we now locked in around the key messages and the FAQs. And really now that the content's locked in, we can get to more of the development of the creative assets, right? So we needed the content first. So
Sure.
I suspect it'll take us the next month to drive some of that home. So April 15th, for sure, we will see a pretty major update, especially to the toolkit section by then.
All right, great. Thanks so much. And a reminder, I apologize. I said July 1st. I spent way too many years in the budget office, and July 1st is just like ingrained in my head, but it's clearly July 16th. And that's obviously 122 days, not 107. So we're going to move to our roundtable and continue our discussion on this topic. And with that, I'm going to welcome in Hannah and Megan for their thoughts in terms of this exciting rollout of the toolkit and the website and the promotional materials and all the communication information that's being made available. So Hannah, I'm going to turn to you first.
Yeah, thank you so much, Tom. And Kate, thank you so much for that overview. It's so helpful for so many of us on the call to hear what's out there and what you're planning. Congratulations on the launch of a web page. It looks great. We were really excited to dig into it yesterday. I would really Kate's comments about collaboration, and not only the collaboration to build this system, but in to communicate about it as well, really resonated with me, because I think that's what we've learned through this whole process, and seeing the mental health and suicide prevention community come together, both in government side and nonprofit organizations, advocates. So many people have collaborated to get us where we are and where we need to go. And I think that's the key to being successful. So I appreciated that Kate referenced that kind of at the top as a core focus of all of this work. And I appreciate that there's a desire to continue in that coordinated approach as we drive the narrative about this in the country. I think that's how Kate phrased it. And, you know, NAMI affiliates, just speaking on behalf of NAMI, are really eager for the framework and the toolkit. And you know, this is really a building block and an opportunity for our organizations to tailor to our audiences. And I'm appreciative that this focuses, so many of the materials focus on a broader scope of 988, talking about the lifeline now, but what the system could and should be, and that it's not just focused on suicide prevention. It's really focused on that broader scope and what that continuum looks like. I think we continue to see confusion about that with a lot of folks across the country. So having that very clear messaging from SAMHSA on this website is so helpful, and it's really great to see that strong explanation of that full vision for 988 and a crisis continuum of care. And before I turn it over to Megan, sorry, Megan, I'm just really excited to hear about what's coming soon and some details about the timeline for that too. Loved seeing everything in the chat, and just would love to hear from SAMHSA how organizations that are on here and partners that are on here can help in spreading that collateral and building out that collateral. But overall, just really excited to see how this is progressing and get some more details and information today. So thank you, Kate.
It was my pleasure, truly.
No, thank you, Hannah. You just nailed it. I mean, the collaboration, the narrative, where I go, my first impressions on all of this is how just extremely appreciative of SAMHSA's leadership on bringing this messaging nationally. States very much want this messaging. And it is just so powerful, quoting Kate by saying common narrative for 988. How important is that to have something addressing frequently asked questions, having venues or vehicles for messaging? I love, Kate, that you are modeling input, even just from the chat, all of the different pieces, refrigerator magnets. I never would have thought that. I have the poison control one on my refrigerator now. Of course we'd want a 988 refrigerator magnet. I also saw in the chat different pieces about multiple languages, and I would encourage an ASL video for accessibility. I just love the consistency, and I love that SAMHSA has this leadership. And I just want to really thank Kate, thank SAMHSA, and that hopeful, crisp, warm, inviting brand, I think is just so important. So thank you very much.
Megan, I had the same reaction about the refrigerator magnets. Poison control, I have that on my fridge.
Exactly. Thank you.
Kate, you used the themes of crowdsourcing, collaboration, and thank you, Megan and Hannah, for your feedback. You both touched on that as well in terms of the importance of building this messaging and then pushing that messaging out. And obviously, you're going to continue to iterate on this. You talked about, you know, continuing to expand on the resources, another big launch in April as you continue to update. How are you going to continue to get feedback from communities in terms of the types of resources, and how, as folks digest this information, if they have suggestions, you know, what, not everybody has access to in this type of forum to just drop something in a chat. So how do you envision continuing to get that type of feedback through this process?
You know, Tom, it's a great question. It's a big question. And I'm not going to sit here and say I know how we're going to do all of it right now, because we are truly building the plane as we're flying it. All I can do is reiterate what the commitment is, and we will continue to use the different ways of convening partners and pulling together the network, whether it grows from the part of the task force that was together for the messaging framework. We've talked about how we can continue to use that or even grow that. It's going to be organically grown. And I do truly understand not just the need out there, but the genuine concern about tailoring for messages as well, tailoring for certain audiences as well. And so I know that that's a real issue for our partners, and we are not going to be able to do all of that at the national level all at once, but we are going to continue to seek input, respond to the input as best we can, and generate communication strategies and messages that we think will help.
Yeah, well, there's no doubt. I mean, SAMHSA is not in this alone, right? So it's up to states and partners and others to be able to take your material and push it out. And so, Megan, I'm going to come back to you, you know, just as you think about this, or even Hannah, if you want to respond to this, right? So as the toolkit rolls out, as it expands, you know, states will be taking that information, as will other partners, and be pushing it out. They may want to be able to customize it to specific languages that are more prevalent within their state. I think of some place like Arizona, where you have the Navajo Nation, right? And putting something into Navajo or other tribal languages. So how do you think states are thinking about this in terms of being able to use and leverage this material? And are there other pieces of information states are going to want to be able to push out? Kate, are we going to see you in a TikTok video too? You know, just in terms of thinking about the different ways of communication.
I hope you don't see me on a TikTok video.
I think, Tom, you bring up a really good point. And I think the people on this call have brought up a good point about how important those different languages are. And I think it's fantastic to be able to tailor these messages for the state and their populations. I think that makes perfect sense. I think as long as there's that common narrative of 988, I have to say, I'm just so inspired by the behavioral health community as well as the wider health community that so many have gotten behind 988. This is just such a pinnacle of history. And so to even have that common narrative about something is a miracle. I mean, really. So, and then to be able to tailor it for tribal nations and different languages and cultures and ASL, I think is critical.
Yeah, I think there's a
Anything you
real,
want to add?
I was just gonna say, I think there's a real need to make sure we are reaching underserved communities. And I think, Kate, probably comes as no surprise that a lot of us are also grappling with how do we communicate July 16th, knowing that we want to start to get the word out, but also don't want to overburden the system right away too. And so, I think any help there as we also try to reach some underserved communities is going to be really helpful. But I think anything that can be tailored to really meet the needs of unique communities who often have not received access to mental health and suicide prevention as much as we would like is going to be really important, and I think is a really valuable component of this.
Great,
And I just want to underscore that, Hannah. From my experience with CDC running national campaigns, what I want to make clear to folks is that the communication we're doing right now is important, and it's part of this idea of making resources available to partners, again, to drive that common narrative about 988. It isn't a research-based behavior change campaign, right? So the campaign work that I'm used to doing at CDC is not what we are currently funded to do. It is what we want to do. And it is what we desperately as a country kind of need to be able to do. And when you do that, you start with formative research. And you start with, in this case, we would really be starting with populations at higher risk of suicide and really understanding knowledge, attitudes, beliefs. We would have to truly understand, how do they think about, perceive their own risk for things like suicide? How do they think about mental health? These terms that we use all the time, how do they think about those, right? We would desperately need to understand, like, what might be motivating factors that would encourage someone to seek help, specifically through something like 988 and using a 988. And then what are barriers to that, and then who are their influencers? Where, if we are going to communicate with them, where are we going to find them, and how are we going to, reach them? And those are through asking about their influencers. And these are very specific audience aspects of audience research that have to truly be the foundation for any communication efforts that we do in terms of a campaign. That's where we would start, should we get funded to do so. And that is what you would want to have happen longer term, as we really do think about the future of 988 and being able to have this be a real resource to folks. Then they have to not just know about it, not just know what it is, but feel confident and safe to use it, right? And you'd end up really with kind of like multiple campaigns, if you will. This is not going to be a one size fits all approach to communication if we go down that path of like a more national level awareness campaign. It would be different ads for different groups to really help reduce some of these barriers and to address some of the perceived challenges.
Eden, you had your hand up. Are you still with us? I know you.
Yeah, I was just going to underscore, I think, a very similar point that Kate just raised around the long-term goal certainly is to be able to do kind of the research intensive, national testing that can inform the way that we think about messaging at a national, local, and communal scale. I think the reality of, and this is captured in some of the FAQs as well, is we are currently not funded to do that or to do anything in the form of a big, national awareness campaign. And so I think it's really important that the FAQs also help to dispel any misconceptions that may exist in different communities, that come July, there's going to be a massive national public awareness campaign. Just very simply, the resourcing and the funding does not currently exist for that to happen. And so I think there are a lot of folks that have mentioned in the chat various degrees of the importance of setting expectations and how we communicate about 988 and how we communicate about the aspirations to transform the broader crisis system. And I think this is an important message to help relay to state and communal partners who are thinking about how to message 988 locally.
Yeah, but also we also have to recognize that there's a bunch of amplifiers out there, right? States and other partners that are going to collaborate on all this, and we certainly need, all of those other partners to step up as part of that amplification. So we could spend our
And Tom,
entire hour on this. I'm sorry, go ahead, Eaton.
No, I was just going to say, I think part of the impetus for putting out materials like this that have gone live is to help provide those who are going to amplify in various corners of the country with the right framing to do so. So I think that's exactly the balance that Kate and team are trying to strike.
Yeah, so we could spend our entire hour on this. In fact, we could extend Crisis Jam by another hour, and I'm sure that folks would want to engage in this, but unfortunately we've got other topics that we need to touch on. So Kate, congratulations first to you and your team for all the work that you've done, and it's great to be able to share this. I know folks are going to want to see the updates as they roll out. I'm sure that we'd love to have you back in a future call. So appreciate your time today. And Hannah and Megan, appreciate you all providing your thoughts as well as we start to roll out all these different resources. All right, so with that, I'm going to welcome in Joanna Rosen. Joanna, you are on the hot seat today, and it is not an easy question. So,
oh boy.
but it goes to the point of the broader call center industry began in the 1960s, and today employs nearly 3 million individuals in the U.S. So it's a mature sector. It's a segment of the economy that's not small, obviously, and there's methods that forecast call volumes in terms of what appropriate service level standards are in place. So what, Joanna, is the mathematical equation for calculating the number of agents and call takers that call centers need? And we have a lot of folks that may be out there that specialize in call center that you may want to turn to in case you don't know this one, or you may just know this one.
I definitely don't. Let's see.
And we have the mathematical equation, if that helps at all in terms of the actual formula that's involved.
Not at all. Can I call on a friend?
Yes, sir.
Maybe?
Call out a friend.
Okay, so I guess according to the audience, everyone is saying A. Most people are saying A.
Well, we have a very, is that your answer or?
Yeah, let's go with A. Let's go with A.
A is correct, Joanna. The audience knows what it's talking about. So it was smart to go with the consensus. It was developed in 1917. So this formula in terms of how we staff our call centers actually goes back now over 100 years in terms of what was developed to look at the throughput and what's actually needed to meet the customer standards. So congratulations.
Yeah.
That was not an easy question.
Completely relied on the audience there. So thank you to everyone.
All right. Thank you. With that, I'm going to turn it over to Stephanie. Stephanie, update on Crisis Talk.
Thanks, Tom. Yeah, so I spoke with Dr. Benjamin Druss this week. He's a professor, and Rosalind Carter, chair in mental health at Emory University School of Public Health. He's developed peer-led whole health programs, which integrate components central to the peer support movement, and also peer-led chronic disease self-management. Dr. Druss, if you're on the call, can you share why peer-led whole health programs must be on the radar of both states and community leaders in their 988 planning and implementation?
Sure. Great to be here with all of you. Stephanie, thanks so much for the invitation. Yeah, I guess my pitch here is to remember that people with mental health conditions are at risk for higher use of not only mental health crisis services, but also medical crisis services. Often these types of problems can be difficult to tease apart for a given individual who's presenting in crisis. So self-management programs are a way of preventing crises among populations with mental health concerns and helping support resilience. So for those of you, for those of all of us who are thinking about developing crisis services, I just encourage you to think both about mental health and physical health as potential drivers of crisis, and then taking a public health approach to crisis care, where you're working upstream to think about supporting whole person self-management to prevent crises wherever possible before they occur. Thanks so much.
Dr. Druss, you mentioned the peer-led component. We go into that quite a bit in the article. Can you talk a little bit about why that element is so critical?
Yeah, I mean, peers are, really wonderful at supporting resilience, at supporting self-management, at supporting engagement in care. They've been historically, the leaders in doing this work for mental health. And I think increasingly also are thinking about their work and supporting whole person health. So mental health, medical, and then also, of course, substance use and social well-being as well.
Thank you so much for hopping on the call. Back to you, Tom.
Thanks, Stephanie. Thanks for sharing that, Dr. Druss. Growing up in the finance side of Medicaid and then evolving my role to the Medicaid director and the mental health commissioner in the state of Arizona, I got to see the work of peers in support of the crisis system in Arizona and the amazing work that they did firsthand, and just amazing in terms of the contributions that they made to the overall delivery system, specifically crisis, but as you also talked about, connecting folks to physical health services as we look at integration and whole person. Next, we're going to hear from SAMHSA. So John, take it away.
Thanks, Tom, and thank you, team. Thanks, David and Brian and Kate. Appreciate your leadership on the communications front with the 988 team. And I know that there's been some great work put together, and obviously a lot of work ahead of us. But really appreciate the partnership and the engagement from the field in moving this effort forward. Also, just wanted to flag. I know it was mentioned at the top of the hour, the New York Times article, and obviously as there's more visibility and interest in 988, obviously more opportunities for there to be broader publicity and awareness of what's going on and what some of the current systems challenges are. And from our perspective, we really have seen this as an opportunity to really highlight what some of the systems needs are, really seeing it as an opportunity moving forward and really framing it as some historic challenges and also an opportunity to really provide a transformative change, and that this is going to take time. So really looking at any of these opportunities where we're engaging around awareness of the system and what the system needs are, really sort of launching the conversation or framing the conversation is really a part of a sort of a journey around transformation, and really recognizing that this is going to take time and that the system is kind of as it is in part due to historic resource challenges. I also wanted to flag that obviously, and this might come up a little bit later in the federal report out, we are obviously aware of the Consolidated Appropriations Act, including the $5 million for the coordinating office through SAMHSA, which we're pleased is an important recognition of the immense amount of work that's been undertaken within SAMHSA to try to coordinate 988 and broader crisis activities. For those of you who have seen it, obviously there's also language in there about a pilot crisis response grant program, and then some specific call out for LGBTQ plus services as part of the Lifeline appropriation. And so there'll be more details about that in the future. And then also wanted to just briefly reflag the national convening that we will be holding on March 24th at 1 o'clock Eastern Time as part of our broad partnership coalition supporting 988 readiness. At that convening, we'll be spending a little bit of time talking about the federal vision, the impact of what we see as the potential for 988 in crisis transformation, walking through a high-level roadmap with some key drivers of that transformative change, and then reviewing operational playbooks and supports and tools that can help drive the system toward readiness, and then wrapping up with some discussion of next phase of learning opportunities moving forward. And with that, I'm going to turn it over to Richard McCann. Or maybe not.
Richard, are you there?
Richard may not be on the call. Yeah, I guess he's not on the call. So I guess we can probably move on to Brian then.
All right. Thanks so much. Brian, take it away.
Thank you, Tom, and thank you, John. And just to reiterate what John just said, that we're looking forward to the convening next week. We appreciate SAMHSA's leadership, and I think it'll be a really nice meeting. I want to thank Kate for her presentation, and just to say that the states are all working on how to communicate, as you mentioned, Tom, how to communicate within each state. They're kind of holding back, waiting to hear from SAMHSA, and it's similar to what Eitan said. It's trying to balance when you reach out, how quickly you reach out, so that you don't overwhelm the new system. So each state is working on that. So next slide, please. And this is just to repeat what we've said the last few weeks, but it's very important, and that is the 988 legislation, the model bill. We'll put that in the chat. And also there's a paper by Arlene Stevenson on the state's experience in legislating 988 crisis services systems. I think that's also interesting for many of the people on the call. And we'll put that on the chat as well. Next slide, please. I wanted to highlight two papers that are on crisis services and substance abuse. And we'll put that in the chat as well. One is a paper by Ken Minkoff, and the other is a paper by Rebecca Boss, and we'll put that in the chat as well. We think these are two papers that address the need to take care of individual substance abuse problems. We know that in some crisis stabilization programs, over 50% of the people that are coming into those programs have co-occurring substance abuse problems. So wanted to really highlight those papers and the importance of addressing that issue. Back to you, Tom.
Thanks, Brian. And as we continue to see the new federal resources roll out, and as we continue to get closer to that July 16th date, I know we're going to look to you and to other states specifically to find out, sort of where they're at in this journey of not only pushing out all of the materials that are now being made available, but also as they're thinking about operations and readiness and what they're doing in terms of system design to be able to highlight some of those state specific efforts. We'll want to do that in upcoming calls, I know. All right, Sarah, I'm going to turn it over to you, and based upon what John was describing, we may have to add more resources to this wave.
Yes, it sounds like it at this point. Since what John was saying, the bill, the FY22 appropriations omnibus bill, was signed into law by the president yesterday, which means we are now going to be turning to FY23, and we expect to start seeing the FY23 president's budget potentially later this month. The other quick update to give is the Congressman Cardenas 988 implementation bill will be introduced tomorrow, and I will share in the chat a link to the press conference that will be from 1 to 2 Eastern tomorrow. And that link also did go out in the newsletter this morning for the Crisis Jam. And next week, Dr. Eric Rothla Yuan from Congressman Cardenas's office will be on to speak about the contents of that bill. But I'm going to turn to Joanna now from AFSP to give a quick update.
Hi, yes. So our update is internal. We have a new federal manager, senior federal manager, starting actually yesterday. So Bill White is on the call. I just wanted to give him a shout out, make sure everyone sees his face. He is joining us after some experience as state healthcare policy and working in government relations and consulting. So Bill, I'll just let you introduce yourself quickly.
Yeah, absolutely. Thank you for that, Joanna. I just want to say hi to everyone. I look forward to working with you all, and I couldn't be more excited to be here and to be working on these important issues. Thank you all.
Yeah, just a few things going on, Bill, so welcome. All right, and with that, over to the states, Steph. Laura.
Yes, Tom, I think I am going to start us off and then I'll have state staff jump in. So what we are seeing, I just wanted to give a broad overview of what's happening in the states. And we're seeing that the legislative initiatives are facing a very high hurdle to pass with their fee components in place. So for the bills, and you'll see here on the map, that have been introduced that are pending with a fee, a lot of those bills are being heard and being stripped of the fee provision. And instead, there is a move towards placing funding, short-term funding, I'm sorry, you couldn't see me, into budget bills, right? So either having an appropriations or otherwise looking into the budget. The map that you see here does not reflect the general appropriations or state budget initiatives for 988. The map reflects standalone bills, but as we think through passage of these bills, and as states are grappling with both, some states do have surpluses, and so the notion of having a fee when you have a surplus, as well as it being an election year, we are seeing that a lot of these fees are getting stripped. So I'm going to turn it over to Steph to give us a play-by-play of the individual bills, but I wanted to set that tone for overall trends.
We're getting some background noise too. If you can make sure you're on mute, that'd be helpful. Thanks.
Thanks, Laura. Yeah, to run through a few of the specific states. In Kansas, House Bill 2281, the House Utilities Committee did eliminate the 20-cent 988 fee provision there and has replaced it with a $10 million allocation of state general funds, right? So that's, you'll see the color change there. For that state. In New Jersey, the Assembly version of their 988 implementation bill cleared their Assembly Health Committee last week. We're hearing there might also be changes there to their fee funding provision, but nothing official just yet. Just a reminder that West Virginia and Mississippi also have 988 bills that have cleared their respective legislatures, but just are awaiting their governor's action. Maryland has Senate Bill 241. This creates a 988 trust fund and also mandates a annual appropriation for 988. That has actually passed the Senate as of today. There was an amendment to that bill lowering the annual appropriation for fiscal year 24 from $10 million to $5 million. But again, just to update that that's cleared one chamber. Rhode Island has Senate Bill 2467. This is really the full model 988 bill. That cleared a committee last week, and the House version of that House Bill 7389 has a hearing today in the House Finance Committee. Also, just wanted to say Ohio House Bill 468, that's a partial model bill, is scheduled for its 4th hearing in the House Behavioral Health and Recovery Supports Committee, and will likely see a vote And just for reference, you don't see Florida lit up on the map anymore. Florida had a 988 study bill, but their legislature has wrapped up its session, so that bill is no longer active. And that wraps up the state update for today.
Steph, just one follow-up question. As you mentioned, Florida, I think a number of states now have wrapped up their legislative sessions, or it's crunch time and it's coming down to the end here very shortly. So do you have any sense? And I also know there's full-time legislatures out there as well. So do you have a sense, are roughly half of the states done or wrapping up? Do we have any sense in terms of where states are at in their overall process for this year?
Yeah, most states are still meeting, but over in the next few weeks, we'll see about 10 or so states wrap up their sessions. So more changes to the map are definitely coming.
Yep. Well, thanks again so much for your update. Stay tuned to continue to track the legislative progress. And again, there are sort of one-offs in terms of each of these where funding may be being made available through other streams that's not indicated necessarily through specific 988 legislation. So obviously an evolving target in terms of how states are sort of piecemealing their strategies around financing of their 988 systems. So next slide, please. We have a number of resources that are available and are tracking the different pieces of legislation that have been enacted. And so you see for each one of these states that have put in place, there's information in terms of what the fee or revenue source is that's available in terms of how much and sort of their estimates of that state in terms of the size of the state. So good information there on those states that have enacted legislation, included a fee, and have included financing. In terms of tools, you're going to want to stay tuned to the Crisis Jam in 2 weeks. We are excited to have Kana on the call to be able to provide an update to the crisis calculator. I've been able to get a sneak peek at it, and you're going to want to see the work that's been done to this to really enhance its capability to be able to do more variable analysis, to be able to allow the user to really be able to make it specific to different regions or states, and to really enhance the overall capacity of the calculator. So I don't want to spoil too much of what's going to happen, but in 2 weeks, there'll be the unveiling of the new calculator. It's going to be a tremendous resource as folks look to the Crisis Now model and the types of resources that are necessary to stand up system infrastructure and the different funding sources that may be available to tap in terms of financing the crisis infrastructure. We continue to update Moving America's Soul on suicide. So episode 3 will be coming shortly, so look for that. And with the revealing of the next several weeks, you see that we've got a number of great presentations that you're going to want to stay tuned for and come back and find out what's happening in terms of the latest for the Crisis Jam. So Christine Alvarez will be with us next week just to talk about some of the challenges in terms of 40 below. 40 below, I believe, is the temperature reference there in terms of serving crisis in Alaska. So and then, as I mentioned, Kana Enomoto will be with us in 2 weeks. And then 3 weeks out, Tim Marshall will be talking about kids crisis care in Connecticut. And I was fortunate enough to be able to host a panel at the National Association of Medicaid Directors meeting where we highlighted Connecticut and the great work that they've been doing there as well. So I want to thank everybody for being with us today. It's been a wonderful hour. Again, thanks to Kate and SAMHSA for all of their work around the crisis communication tools. And we look forward to seeing that and digging into the website, and congratulations on the launch of that. And again, thank you all for joining us. It's been a lot of fun and a lot of information shared as usual, just trying to keep up. It's the fastest hour out there in crisis. So thanks for joining us. Have a great day.